Obsessive-Compulsive Disorder, OCD, and Narcissism are two distinct psychological conditions that can profoundly impact an individual's behavior and interpersonal relationships. While both disorders have been studied extensively in isolation, the intersection of OCD and narcissism within personal relationships is a complex and intriguing area worth exploring. OCD is a chronic mental health disorder that falls under the umbrella of anxiety disorders. It is linked to recurring, uncontrollable thoughts or obsessions, and behaviors or compulsions that the person feels an irresistible urge to repeat. Obsessions are intrusive and unwanted thoughts, images, or urges that trigger intensely distressing feelings. Common obsessions might revolve around themes of contamination, orderliness, or fear of harm to oneself or others. Compulsions, on the other hand, are behaviors or mental acts that an individual engages in to attempt to get rid of the obsessions or decrease their distress. These may include actions like excessive cleaning, arranging things in a particular way, or compulsive reassurance seeking. The cycle of obsessions and compulsions can consume significant time and energy, often several hours a day, causing considerable distress and impairing daily functioning. The person with OCD usually tries to ignore or suppress such obsessions or neutralize them with some other thought or action. Narcissism, or more specifically, narcissistic personality disorder, is a mental condition where people have an inflated sense of their importance, a deep craving for attention and admiration, coupled with a lack of empathy for others. This personality disorder creates a pattern of grandiosity, a need for admiration, and a lack of empathy. Narcissistic individuals have a grandiose sense of self-importance, believing that they are superior or special compared to others. They will exaggerate their achievements, talents, and expect to be recognized as superior without commensurate achievements. Their need for excessive attention and admiration is a defining feature of this disorder. Narcissists require constant praise and admiration to bolster their self-esteem and maintain their inflated self-image. Perhaps one of the most challenging aspects of narcissism is the individual's lack of emotional empathy. This lack of empathy leads to troubled relationships as they do not value and respect the needs and feelings of others, leading to exploitative behavior. When exploring how OCD and narcissism impact personal relationships, two scenarios can occur. One scenario involves one partner in a relationship who exhibits traits of both narcissism and OCD, while the other scenario sees one partner having OCD while the other has NPD. The dynamics in these two situations can be quite different. In a relationship where one partner embodies both the compulsive need for control indicative of OCD and the inflated self-perception and lack of empathy characteristic of narcissism, a unique and challenging dynamic is created. Individuals with OCD grapple with an overwhelming need to exert control over their environment as a coping mechanism to manage their anxiety. Their obsessions, driven by unease and fear, trigger compulsions, which are behaviors designed to assert control over their surroundings or situations to prevent their feared scenarios from materializing. For example, an individual obsessively fearful about contamination might attempt to control their environment by excessively cleaning or avoiding public places. Such a need for control can transform into rigid routines and rules, which can be challenging for partners or family members to acclimate to, potentially leading to tension within the relationship. In sharp contrast, narcissists seek control to uphold their perceived superiority and grandiosity. They will maneuver and manipulate their partner, in an attempt to steer the course of their relationship and make their partner conform to their desires and whims. This pursuit of dominance can spark power struggles within relationships, as narcissists will habitually disregard the needs and desires of their partners. The interplay of these control dynamics can foster conflict and tension, straining relationships and creating a constant atmosphere of friction. Narcissism is commonly associated with a significant lack of empathy, a vital component for healthy, reciprocal relationships. When this trait coexists with OCD, it inevitably intensifies relationship difficulties. Individuals with OCD, consumed by their obsessions and compulsions, often unintentionally overlook the needs and feelings of others. This preoccupation exacerbates the inherent lack of empathy in narcissism, creating a substantial empathy deficit within the relationship. A narcissist harbors a constant need for admiration and validation. This need places an excessive emotional burden on their partner. They feel pressured to constantly reassure and lavish praise on their partner, a task that can become emotionally taxing over time. This incessant demand for reassurance can further strain the relationship dynamics, adding to the complexities of navigating a relationship where one partner embodies both OCD and narcissism traits. In a relationship where each partner embodies a different set of psychological traits, one with obsessive-compulsive disorder and the other with narcissism, the dynamics become even more complex. Each partner brings their unique struggles to the relationship, contributing to a complex interplay of emotions and behaviors. In this dynamic, the partner with OCD will grapple with a heightened need for control and order, which manifest as specific routines and rituals they feel compelled to perform to manage their anxiety and obsessive thoughts. This inevitably creates conflict with the narcissistic partner, who also craves control but for a different reason, to maintain their fragile self-image. In addition, the narcissist is unlikely to empathize with their OCD partner's struggles. Moreover, their constant need for admiration and validation can clash with the OCD partner's need for reassurance and control. This mismatch can trigger a cycle of mutual dissatisfaction, where each partner feels their needs are not being met, further complicating the relationship dynamics. The emotional distress associated with OCD can be exacerbated by the narcissistic partner's inability to provide emotional support. This lack of emotional support can initiate a vicious cycle for the person with OCD. The heightened anxiety may trigger an increase in obsessive thoughts, leading to more compulsive behaviors as a means to alleviate the distress. This escalating cycle can strain the relationship further, as the narcissistic partner may feel neglected or overwhelmed by the increasing severity of the OCD symptoms. In conclusion, while OCD and narcissism can bring unique challenges to personal relationships, understanding these complexities and seeking appropriate help can pave the way for healthier interactions. Remember, every individual and relationship is different, and what works for one might not work for another. For more information about narcissists and narcissistic abuse, visit www.carlacorelli.com.